Good morning. Thank you for joining us today here at Storen Financial. My name is Ruth Hoffman, and I am their Medicare benefits specialist. And today we're going to be addressing the Medicare Made Clear for those individuals perhaps that are coming on to Medicare or already on Medicare and maybe have questions. So thank you for joining us. So just to share with you, Storen Financial has a Medicare advisory service. And our goal is to help individuals coming onto Medicare understand what options they have, as well as helping those already on Medicare better understand their benefits. This is an area where I think folks sometimes feel a little bit overwhelmed because it's different from what you've been accustomed to. Perhaps, receiving benefits through an employer is way different from when you come onto Medicare. So thank you for joining us. So again, to share with you, I've been in the business since about 2006, so it's going almost into 20 years. And my experience has been in the Medicare arena. I'm certified to sell Medicare Advantage plans as well as Part D and Medicare supplement plans. I am licensed in life and health, and I am also certified for PNC, which I do not practice. So basically, your interactions with an advisor here at Storen when it comes to analyzing what your needs are for healthcare comes to you at no cost. There is no cost affiliated with consultation. It's provided to you on a free basis. And basically what we're going to do is to evaluate your healthcare options and determine whether moving to Medicare is the way to go, because there are sometimes cases where you're still working and maybe staying on your employer plan's the way to go. So it's important to understand what your responsibilities are going to be on a financial basis once you come on to Medicare, because there are risks that you're going to have to be aware of as you move in that direction. So let's get into the presentation. I'm using the PowerPoint from United Healthcare. It says get to know Medicare. So that's what we're going to do this morning. So the top 10 questions that we're going to cover here today is, what is Medicare? Who can get Medicare? Do I need Medicare if I plan to work past 65? What does Medicare cover? Where can I get more coverage? What does Medicare cost? How do I choose Medicare coverage? When can I enroll? When can I change my coverage? And how can I save money? All important topics. So what is Medicare? Just to share with you, Medicare is a federal health insurance program for eligible U.S. citizens and legal residents. It's funded in part by the taxes you pay while you work, and it's individual insurance. Medicare is not free, a family health plan, Social Security, or Medicaid. So who gets Medicare? So again, you have to be a U.S. citizen or a legal resident. A legal resident must live in the U.S. for at least 5 years in a row, including the 5 years just before applying for Medicare. So in order to be eligible for Medicare, you have to be age 65 or older. You could be younger than 65 with a qualifying disability, any age with a diagnosis of end-stage renal disease or ALS, which is Lou Gehrig's disease. So your Medicare enrollment options when working past 65 may be different. You may be able to delay, or you may have to enroll at age 65. So let's look at both sides. Generally, you can delay Medicare past age 65 without penalty if the employer has 20 or more employees. The employer health coverage is considered credible. You need to enroll at age 65 if there are fewer than 20 employees, or your coverage is not considered credible. So what if I'm covered by my spouse's employer? That's a really good question. You may be able to delay if your employer-based health coverage is through your spouse. You may have to enroll. It depends on the spouse's employer and any rules the employer has around covered dependents. So you may want to get that addressed if you are covered under your spouse's plan. So getting Medicare while still working, There's the scenario where Medicare and your employer insurance can work together. So you could have Medicare Part A and Part B and also have your employer coverage. If you take any part of Medicare, whether you take Part A and B, or Part B, you will no longer be able to contribute to your health savings account. There would be a tax consequence for that. So that's another thing you need to consider. Medicare will not cover anyone but you, so consider how any of your dependents are covered. What does Medicare cover? So original Medicare has two parts. It has a Part A and a Part B. Part A basically is hospital insurance. It helps pay for hospital and inpatient care. And Part B is medical insurance. Basically, it covers for doctor visits, outpatient services. Those are the two parts of Medicare. So let's talk about what Medicare Part A covers as an inpatient. So it covers your room and your meals, care in special units such as intensive care or just a regular ward, prescription drugs and medications supplied during your in-hospital stay, lab tests, x-rays, and medical equipment as an inpatient, operating room recovery. If you have to go to a skilled nursing facility for rehabilitation, that falls under Part A. Some blood transfusion, hospice care, including medications to manage symptoms and pain, part-time skilled care for the homebound after a qualifying inpatient stay, and rehabilitative services after a qualified inpatient stay. All of those fall under Part A. So be aware that Part A is premium free if you or your spouse worked and paid taxes for 10 years or longer. You can't be denied coverage. Coverage is nationwide, including any qualifying hospital in the US. Coverage and costs are per benefit period, and I'll touch on that. You must be admitted as an inpatient. There's another category in which you could be in the hospital but be under what's called observation status and provide 60 lifetime reserve days. Now, Part B covers doctor visits and outpatient care, including your doctor office visits, even when you're in the hospital. You get an annual wellness visit and preventative services like flu and pneumonia, lab fees, x-rays, MRIs, CT scans, some health programs like smoking cessation or obesity counseling, physical therapy, occupational therapy, speech therapies. Basically, under the Part B category, it's any service where you're walking in and walking out. Mental health falls under that category, durable medical equipment. And if you have to take an ambulance trip or you go to an ambulatory surgical center, those fall under the Part B category. Now, Part B has a premium, and it's based on your adjusted income 24 months prior to coming onto Medicare. And that basically is called IRMMA, which is Income Related Monthly Adjustment Amount. So it's IRMMA. So if you want to know what your monthly premium is going to be for your Part B or your Part D, go to Medicare.gov and Google IRMMA. You can't be denied coverage. Coverage is nationwide, including any provider who accepts Medicare. And there could be premium penalties for late enrollment unless you qualify for a special election period. So enrolling in Part B on a timely basis is important so that you prevent those late enrollment penalties. So again, let's look at what Medicare does not cover. So original Medicare A and B does not cover all of the costs of your care. You will have out-of-pocket costs, and I want you to underline with no limits. So if you have a poor health year and you're just on Medicare A and B, it could be financially costly for you. It doesn't cover prescription drugs, routine vision, dental, or hearing, glasses or contacts, does not cover long-term custodial care, excess charges that may be submitted by a physician that does not accept Medicare assignment, and care received outside of the United States except for certain circumstances. That's another important one. If you're on original Medicare and you travel outside of the United States, I always advise my clients to purchase health insurance for the duration of your trip. That's different than, let's say, a trip cancellation. It's specifically for medical needs. Where can I get more coverage? So everything starts with having Medicare Part A and Part B in place. And then once you get your red, white, and blue card, you can consider option number 1 or option number 2. So let's talk about option number 1. You can add one or both of the following to original Medicare. In order to have prescription coverage, you're going to have to add Medicare Part D plan, which is a prescription benefit. And those are offered by private insurance companies. You may also wish to add a Medicare supplement insurance plan, because as I mentioned earlier, being on Medicare Part A and Part B, you will have out-of-pocket costs, and the Medicare supplement plan will coordinate with original Medicare to help you minimize your out-of-pocket exposure. The other choice that you have, you still have to be enrolled in Medicare Part A and B. However, there are private insurance companies that offer what's called a Medicare Advantage plan or a Part C. And with a Part C, when you're enrolled in a Medicare Advantage plan, the Advantage plan is delivering the A benefit, the B benefit, and many of the plans also include Part D for prescription. So it's an all-in-one plan. And then it brings you some additional benefits like vision and dental. So again, you have to be enrolled in Medicare Part A and Part B, and then you decide whether you want to be under option 1 or option 2. It's an either or. You're not going to be under both. Okay, let's talk about the Medicare Advantage plan. It's another way for you to get Medicare benefits. What happens is that Medicare and these private insurance companies have a contract that they have on a yearly basis to deliver these plans. So it's an alternative to original Medicare. Plan members are still part of the Medicare program and will be required to pay their Part B premium. The benefits when you're under a Medicare Advantage plan are administered by the plan. Plans are offered by private insurance companies. Most plans have the prescription benefit built in, and they do offer some additional benefits such as dental, vision, and fitness. So let's talk about the Medicare Advantage plan. All Medicare Advantage plans, just like original Medicare, must cover the Part A and the Part B. And like I stated, many of them will include the prescription benefit, although there are some Advantage plans out there that do not offer prescription benefit. And again, like I mentioned, there are some additional benefits that you get with the Advantage plans that you don't necessarily get with being just on original Medicare with a supplement plan. So these are the types of Medicare Advantage plans that are offered currently in the marketplace. They may not all be available here in the central Indiana area, but these are what's available across the United States. So the ones that are common are like the Health Maintenance Organization. It's an HMO. All services have to be provided by network providers and hospitals under that plan. With a preferred provider plan or a PPO, those are plans that have contracts with doctors and hospitals, but it allows you to have benefits outside of the network. There are some that are called special needs plans, and those are for folks that maybe have both Medicare and Medicaid or have a chronic condition. There are Advantage plans for folks that are institutionalized, like in a long-term care facility. And then one other that I want to mention is the Medical Savings Account. That's a plan that provides your A and B services or A and B benefits, and then you would add a prescription drug plan. So it's just a different type of Medicare Advantage plan that you might be interested in. So that's why it's important to meet with an advisor, a Medicare benefit advisor that's familiar with the different options to give you guidance depending on what your needs are. All right, so more facts about Medicare Advantage plans. Like I mentioned before, you must be enrolled in A and B. you live in the plan area, it's specific to your state and county. You can't be denied coverage based on current financial or health status, including pre-existing. You may be required to use providers and pharmacies that are networked with the plan. Coverage and costs vary by plan and may change each year. Like I mentioned, these plans are in place from January 1st to December 31st on a calendar year basis. And each year you'll get plan information telling you what the plan is going to look like for the following year. Typically that comes starting October 1st of the current year. There are annual limits for your out-of-pocket costs under these Advantage plans. And this is where you get protection financially with an Advantage plan. You may be charged a monthly premium. Some of these plans have a premium, others have a zero premium or no cost. And like I mentioned, you must continue to pay your Part B premium to Medicare. That will either come out of your Social Security check, or you will make arrangements with Medicare to pay that either monthly or quarterly. Let's talk about Medicare Part D. It's a prescription drug coverage. There's two ways to receive your prescription drug benefit. You can have it either as a standalone drug plan, or it could be embedded within the Medicare Advantage plan. Doesn't matter which way you get it, the benefit is set by Medicare on an annual basis, and that is what the plan has to deliver to each individual that's enrolled. So Medicare Part D covers types of drugs most commonly prescribed for Medicare beneficiaries as determined by federal standards. So the Part D works when it comes to medications you're going to your local pharmacy to pick up. So it could be brand medication or generic medication. And it's important to know what medications you're on to make sure that the plan is going to deliver those to you without having a disruption in getting those filled. Commercially available vaccine drugs are not covered under the Part D or prescription benefit. That typically falls under the Part B as in boy. So when we look at a prescription drug plan, as you see here to the right side, it goes from a tier 1 to tier 5. And as we move from the top to the bottom, if your drugs fall in different tiers, you can expect to have higher out-of-pocket costs as you go from tier 1 to 5. So drugs are grouped in tiers based on costs. In general, the lower the tier, the lower the cost, and deductibles may be charged by tier. So that's something you'll have to better understand depending on which medications you're taking. So just to share with you for this particular calendar year, there are some plans that have a plan deductible for certain prescription drugs, especially if you're like in a tier 4 or 5. For this calendar year, the deductible for some plans is like $480. If you have, generic medications like tier 1, tier 2, or even tier 3, there may be no deductible at all. So the initial coverage with a Part D benefit for this calendar year, whether you start January 1st or you start October the 1st, is $4,430 worth of total drug cost. Once that benefit is depleted, you go into what's called the coverage gap or the donut hole. And so when you are there, up to $7,050 out-of-pocket cost is that new phase that you move into. Doesn't mean that you're going to be responsible for the $7,050. When you move into that coverage point, you're paying 25% of your drug cost, and the plan is paying the other 75%. And together we work to satisfy that $7,050. If we satisfy that and we still have days left in the calendar year, then you move into what's called catastrophic coverage, in which then you only pay 5% till the end of the year until a new benefit starts January 1st. So be aware that typically when you have a plan that delivers drug benefit, whether it's a standalone or embedded in an Advantage plan, you're going to get a statement 30 days in the rear that's going to tell you how you're moving along in spending down your $4,430 and moving into the next phase or the following phase. Just be aware that when you get prescriptions filled, even though you may have a small copay or co-insurance on your prescription, the total drug cost comes off that $4,430. It's what you pay and the plan pays that comes off that benefit. Okay, so in order to enroll in a prescription drug plan, you must be enrolled in Medicare A, Part B, or both. You may be required to use certain pharmacy networks. Coverage and costs vary by plan and may change each year, and it will change. Typically, the benefit for next year will probably go up by a couple $100, but then the gap amount will also go up by a couple $100. There are late enrollment penalties if you don't put a drug plan in place when you first become eligible, unless you have what's called a qualifying special enrollment period. Let's talk about the Medicare supplement insurance, or the Medigap policy. That's the one that would complement original Medicare. It's going to cover the out-of-pocket costs that you are required to cover when utilizing Medicare Part A and Part B. It can't be used to pay your Medicare Advantage cost. Medicare supplement plans, there's 10 plans that are standardized by the federal government, and depending on when you turn 65 will determine which plan you'll be eligible for. The plans are labeled by letters, for example, like a Plan A and a Plan G, and depending on which plan you enroll in is going to determine what costs and services, how they're going to be covered, and what your expectations are to pay for that particular plan. The thing with a supplement plan, it's offered across all 50 states, and the plans are the same. It doesn't matter which state you're in. If you enroll in a Plan G, the benefits are the same here as they are in the state of Washington. These supplement plans are offered by private insurance companies, so someone like myself can help you enroll in the plan. So what happens with being on original Medicare with Part A and Part B, that's option number 1 several slides back, is that when you're utilizing services like you're in the hospital, you're going to have a co-insurance and a deductible. So if you're enrolled in the hospital, whether you're there 1 day or 60 days, that's called the benefit period. Medicare is going to cover everything but about a $1,500 deductible. And then the doctors that see you, Medicare is going to cover 80%, and then you would have a 20% responsibility up to a certain point. So that's why it's important, if you're going to stay on original Medicare A and B, that you complement it with Medicare supplement insurance so that you limit your financial exposure. Part B has co-insurances and copays, and there's an annual year deductible there about $300. The supplement plans also provide you benefits of covering the first 3 pints of blood if you're as an inpatient in a hospital. And it will extend your benefits of covering 365 extra hospital days if you have a long hospital stay. Hospice care is also covered under original Medicare. Part B and Part A do have deductibles. I've mentioned that. Cost of foreign travel, emergency care up to a limit, and provides charges above what Medicare approves. So there are some limited benefits you get for foreign travel with a Medicare supplement plan. However, I would still advise you to buy a health insurance plan for the duration of your trip if you are leaving the United States. What the supplement will not cover is prescription drugs at the retail level. It does not provide routine dental, vision, or hearing benefits. There's no assistance for eyeglasses or contacts. No assistance for custodial care and long-term care if it's not a admission for rehabilitation is not covered by Medicare and therefore is not covered by the supplement. So when you enroll in a Medicare supplement plan, Medicare pays first and then the supplement pays secondarily. If Medicare does not see it as a benefit, like the ones on the right-hand side, doesn't matter that you have a Medicare supplement plan in place, they will not pay. Medicare must pay first. Other facts about a Medicare supplement insurance: you must be enrolled in both Medicare A and B and live in the state where the plan is offered. There is no medical underwriting up to 6 months after enrolling in Part B at age 65 or older. That's a really important point. So if you want to put a Medicare supplement plan in place, it's always advisable to do it in the 6 months just after enrolling in Part B, so that you don't have to answer any medical underwriting questions. It's guaranteed renewable as long as you continue to pay your premium. Plan premiums may vary for the same coverage. Plans with more coverage generally have a higher premium, and you must continue to pay Part B premiums to Medicare. And over time, your supplement, Medicare supplement plan, will have premium increases year after year. It's like your homeowners and your auto. So how much does Medicare cost? So again, Medicare, and when we talk about Medicare costs, we're talking about Medicare Part A and Part B. There are premiums that are attached to the Part B enrollment. And again, you want to go to the Medicare.gov and Google IRMMA. Again, that's IRMMA. And it will tell you, based on your gross adjusted income, what your Part B premium is going to be, and perhaps if you'll also have an IRMMA for your Part D. Deductibles is a set amount that you pay for covered services before your plan begins to pay. Co-payments, it's a fixed amount you pay at the time you receive covered benefits. And then co-insurance is a percentage. Typically under original Medicare, they cover 80%, and then you would be responsible for paying 20%. Let's talk about plans will vary in costs. They choose to include in how much. So the choices that you have, again, is to consider a Medicare Advantage plan or a Part C, a standalone drug plan, or a Medigap plan that coordinates with original Medicare. So let's talk about what you might incur if you're looking at a Medicare Advantage plan. Some of the plans have a no-cost premium or a very low cost on a monthly premium. There are deductibles and co-insurances as well as co-pays. Now, again, with a Medicare Advantage plan, each plan has what's called an annual out-of-pocket maximum for covered services. And typically those are the co-pays and deductibles and co-insurances that you pay for services under A and B under the Medicare Advantage plan. For prescription drug plans, you will have a monthly premium. You may or may not have deductibles depending on what tier drug you're having filled at the pharmacy. There could be co-pays and co-insurances. For the Medicare supplement insurance plans, there will be another monthly premium. There could be deductibles and co-pays depending on which plan you enroll in. So how do I choose? So this is a really important graph here because, again, everything starts with enrolling in Medicare A and B. You must have both to then move into step 2. So depending on what your likes and dislikes are will determine whether you go with option 1 or 2. With option 1, you can add one or both. I would highly recommend you add prescription drug coverage so that you have benefits at the retail level when you go to the pharmacy. And then I would also recommend, if you stay under option number 1, to put a Medicare supplement in plan, because as I mentioned before, Medicare has deductibles, co-insurance, co-pays, that if you don't put a Medicare supplement plan in place and you have a poor health year, it could be very costly. Under option number 1, the beauty of being on original Medicare is that you can go to any doctor and any provider across all 50 states. And as long as they're willing to file with Medicare, you can get taken care of by those providers. With option number 2, under a Medicare Advantage plan, they're offered by private insurance companies. And depending on where you live and which county you are in, it is tied to a geographical area. The Medicare Advantage plan will deliver benefits under A and B under one plan. Many of them include prescription, and they provide additional benefits and services that are not offered by original Medicare. For example, like vision and dental, fitness membership, just to mention a few. All right, so let's talk about, the good, what's good about a Medicare supplement plan or a Medigap policy versus a Medicare Advantage plan. So again, original Medicare pays first, then the Medigap or the supplement plan pays secondarily. So it's going to pick up some of the costs not paid by original Medicare. It does not cover drugs at the retail level. It is national coverage and may also offer some additional value-added services depending on which plan you select. The Medigap policy has a monthly premium. That's your responsibility. And then you would have to add a prescription drug plan in order to have prescription at the retail level. So that is another premium. The convenience is multiple plans when you add to original Medicare along with Part D is going to deliver your healthcare benefits. On the other side, with a Medicare Advantage plan, it provides benefits of original Medicare. It includes prescription drug coverage at the retail level. You may have a provider network, and it does provide additional benefits like dental, vision, and hearing. Some plans do have a premium, but they're really quite affordable. Often no additional premium for drug coverage. Under an Advantage plan, you will have co-pays and co-insurances for most services up to the annual maximum out of pocket. And under the Medicare Advantage plan, it's an all-in-one plan. So when you're enrolled in a Medicare Advantage plan, you're going to show your Medicare Advantage card. You're not going to show the provider or the hospital your Medicare card, because Medicare and these private insurance companies are going to register in the system when you're enrolled in a Medicare Advantage plan that is who will be responsible for delivering your healthcare benefits. It takes original Medicare off the hook. So when can I enroll? So for those individuals that are turning 65, you have what's called your initial enrollment period. It's 3 months before, the month of, and 3 months after your 65th birthday. If you are collecting or drawing Social Security or railroad retirement benefits at age 65, you will automatically get a red, white, and blue card in the mail. If you are not drawing benefits, then you must go to ssa.gov and enroll online or call or visit your local Social Security office to enroll in Medicare. So going to the socialsecurity.gov website is where you start to make the request to enroll in Medicare. Once that's been approved, then they communicate that to Medicare, and then you will get your red, white, and blue card in the mail. The Medicare Advantage plan, the Part D, and the Medigap, you need to enroll directly with the plan provider. Someone like myself that is familiar with all of these products can be of a great value in helping you decide which way to go. Now, it's really important to enroll early to avoid gaps in coverage and late enrollment penalties. You may refuse or delay enrollment in Part B with credible employer coverage. So if you're currently employed and you're age 65 and you deem your employer plan to deliver good benefits and they're deemed to be credible, then you do not have to enroll in Medicare A and B. And like I mentioned before, if you have a health savings account, you want to delay enrolling in Medicare A and B, because there is a consequence, a tax consequence, if you do not discontinue contributing to your health savings account. All right, there's a general enrollment period. Typically, for those who miss their initial enrollment period, you may enroll in Medicare A and B or both during January through March. And then that becomes effective. You can get plans effective for July 1st. You can extend that through April for June if you wish to enroll in a Medicare C, which is the Advantage plan, or a standalone D. Okay, And again, remember, there are late enrollment penalties if things are not done in a timely fashion. Medicare supplement open enrollment period. This is the guaranteed issue that I mentioned several slides earlier. You know, once you enroll in Medicare Part A and B, the clock starts on your 6 months. This 6 months begin the month in which you turn 65 or older and enroll in Medicare Part A and Part B. This 6 months allows you to enroll in any supplement plan you qualify for with no medical underwriting. If you enroll at a later time, you could be denied or considered to have some pre-existing condition that would prompt the plan to charge you more for that Medicare supplement plan. There are other and special enrollment periods. For example, let's say you're employed past age 65 and you're separated from your employer, and now you want to enroll in Medicare. So you have to put Medicare Part A and B in place, and then you have up to 8 months in which to put coverage through Original Medicare or a Medicare Advantage plan. Be aware it's really important to do this on a timely basis, because there could be consequences. For example, that last bullet point, you have exactly 63 days to get a standalone Part D or a Medicare Advantage plan with prescription drug coverage without penalty. Doesn't mean you couldn't go out, you know, the full 8 months, but if you go past the 63 days, then Medicare is going to assess you a late enrollment penalty. Okay, so let's talk about late enrollment penalties for Original Medicare. For Part A, none if you qualify for premium free. That's for folks that are financially strapped and qualify for both Medicare and Medicaid. If you don't fall in that category and you delay putting your Part A when you should have, then the penalty is 10% of the Part A premium, and that's with you for the duration of the time that you're on Original Medicare. For Part B, there is no penalty if you have what's called a special election period. For example, you delay leaving your employer plan because you've worked to age 69 and now you're coming on to Original Medicare, you won't be assessed a late enrollment penalty. But if that is not the case, then the penalty is 10% of the monthly Part B premium amount for each full 12-month period enrollment was delayed. And you can find this information also at medicare.gov. And then in regards to prescription drug coverage, you have no less than 63 days without credible coverage before you're going to be assessed the late enrollment penalty of 1% of the average Part D premium for each month you delayed enrollment. When can I change my plan? So we're moving into what's called the annual enrollment period that starts October 15th to December 7th. This is for folks that are already either on Original Medicare with a prescription drug plan, or they're on a Medicare Advantage plan. It gives you the opportunity to evaluate what you've been on for the last year and decide if you want to either switch back to Original Medicare or vice versa. And if you return back to Original Medicare, you might want to consider enrolling in a Medicare supplement plan and adding prescription drug coverage. That happens every year between October 15th and December 7th. You're going to start seeing a lot of advertising on television about the annual enrollment period from, you know, many of the private insurance companies that offer plans in your area. Okay. Now, there's a Medicare Advantage open enrollment period each year, and this is only for individuals that are on a Medicare Advantage plan. So January 1st through March the 31st, you can switch to a different Medicare Advantage plan or return back to Original Medicare. You can, you know, pick up a standalone drug plan if you return back to Original Medicare. And just one cover change is allowed during January 1st through March the 31st of each year. Special enrollment periods, for example, you can 2 months, you know, after the event happens. For example, you move from Indiana to Florida. or you're leaving a retiree union or COBRA coverage, you're able to make a plan change for either a joining change or drop a Medicare Advantage plan, prescription drug plan during this time. How can I save money? We're all trying to do that right now with the cost of living the way it is. I would tell you, doesn't matter if you're under option number 1 or option number 2, use preventative services. The sooner they are able to identify perhaps a condition, the better the outcomes are going to be. If you're in a plan where provider networks are important, make sure you're utilizing those networks. Ask about generic and low-tier prescription drugs. If you're on a brand medication right now, it may be a time to talk to your family doctor to see if there's an alternative that is not as costly, because like I mentioned, it is a fixed benefit on the drug side on a calendar year basis. And once you spend that benefit, you go into the gap or the donut hole. And it's important to understand your status in the hospital. More importantly, are you admitted or are you being observed? Because depending on what category you are identified as being in is going to determine how Medicare is going to deliver benefits to you if you need, for example, to go to a skilled nursing facility for rehabilitation. All right, so let me talk a little bit about, if you have financial assistance issues, some folks do, you can get extra help with your Medicare Part D cost. Typically, it's through Medicaid. I talked about the Medicare Savings Program. That particular Medicare Advantage program helps with your Medicare A and B out-of-pocket cost. And then there's programs that are called all-inclusive care for the elderly. It's called the PACE. So the other option you have is to call Medicare or talk to our state office has what's called a SHIP office. And if you Google that in the state of Indiana's website, they'll tell you what numbers to call. Where can I go for help? Okay, well, these are just some suggestions. The ones that I would highly recommend would be, if you've not visited Medicare.gov, it's an excellent place to start. You can also call them, or you can contact your local Social Security office or state Medicaid office. I would also recommend that if you'd like to schedule a no-cost consultation fee with myself here at the Storen Financial Office in Zionsville, it would be my pleasure to do that. I also want to share with you that Storen Financial offers more than just the Medicare advisory service. If you're not familiar with us, we do financial advising as well as tax preparation. And so if you have a need for those services, please keep us in mind as well. So again, thank you. My name is Ruth Hoffman, and it's been a pleasure spending time with you this morning. Have a great day.